Welcome, everyone. My name is Sarah Eaton, and I'm an analyst with the California Department of Education, Office of School-Based Health Programs. I am honored to co-host this webinar in collaboration with our partners at the California Department of Public Health, Office of School Health. The CDE, Office of School-Based Health Programs, and the CDPH, Office of School Health teams are excited to continue supporting local health and educational communities across California by providing important information, guidance, resources, while also highlighting the incredible individuals who are making a meaningful impact for California schools and the surrounding communities. With that, I'm pleased to introduce today's webinar, Supporting the Whole Child Through Promoting Family and Community Engagement. Next slide, please. So please take some time to introduce yourself in the chat by sharing your name, your title, organization, and one way your school, district, or agency partners with family and communities to support student and youth well-being. I would like to note that the question and answer feature will be open for the remainder of the webinar for any questions you may have. So while we're introducing ourselves in the chat, we would like to highlight the objectives for today's webinar, and I will share those in the chat along with today's agenda. The first webinar objective is strengthen cross-sector collaboration. We are going to identify effective approaches for building strong, sustainable partnerships between schools, families, community organizations, and public health agencies. The second objective is enhancing family and community engagement, promoting inclusive practices that encourage families and communities to actively participate in decision-making related to student health and development. And our third webinar objective is expanding community-based supports. This is highlighting no-cost resources, services, and local programs that help remove barriers and foster long-term stability for students and families. So as I go ahead and share that in the chat, we can go to the next slide. And I have the honor and privilege to introduce our first speakers, Ryan Skaggs, Program Director at the CDPH Office School Health, and Dr. Carrie Squara, Administrator at the Office of School-Based Health Programs at the California Department of Education Whole Child Division. Please join me in welcoming Ryan Skaggs.
Yeah, thank you, Sarah, and welcome everybody. My name is Ryan. I use he, him pronouns. On behalf of the California Department of Public Health, Office of School Health, I want to welcome you to today's webinar. I want to acknowledge that Californians from all walks of life are joining us from cities and counties across the state today, and that we're all here united in our support of the well-being of California's students and our shared commitment to building healthy, safe, and supportive schools for all Californians. Today's webinar is on a very important topic and focuses on how we can integrate family and community engagement into systems of prevention and care. We have a lot of amazing guests. We'll also share out some tools and some resources that you can implement into your school communities. I want to acknowledge that we are navigating very difficult times together and reiterate, as always, the CDPH Office of School Health is here to support you. I know a lot of folks may be joining us today who don't join us on our regular webinars, so take a little bit of time to introduce our office. We are the California Department of Public Health Office of School Health. We're also known as Safe Schools for All. We're here to partner with education, health organizations, and state, local level to support the health, safety, and well-being of California's 7.5 million students, staff, and their communities in California's 10,000 TK through 12 schools. So you can go to the next slide, please. This is a little bit about what we do. A lot of you may know that we host webinars every 2 weeks on Tuesday afternoons. If you'd like to subscribe to our mailing list or to join our webinars, you can send us an email at safeschoolsteam@cdph.ca.gov. A lot of our work focuses around developing and providing scientific public health guidance and policies. We also manage the state's epinephrine and albuterol standing orders, which help provide access to life-saving medications in schools without the need for a physician's prescription. We support school-based health centers and facilitate collaboration between state and local education and health officials. And as I mentioned, one of the big ways that we do this is by hosting communication platforms, including biweekly webinars. We maintain and oversee school-based behavioral health programs, and we also maintain a vast communications network. So I'd like to invite you to join us again. If you would like to subscribe to our webinars or to join our mailing list, you can send us an email at safeschoolsteam@cdph.ca.gov. We're also available for any inquiries, training, or technical assistance needs you might have. So you can also reach us at that shared inbox. Again, want to welcome you to today's webinar. We have a lot of amazing guests. And with that, I'd like to turn it over to my colleague, Carrie, from the CDE Office of School-Based Health Programs.
Thank you so much, Chief Skaggs. It's always a pleasure to be here. Good afternoon. I am Carrie Sequoia, and I oversee the Office of School-Based Health Programs with the California Department of Education. It's an absolute pleasure to be here and share space with all of you today. I would be amiss if I did not personally thank Chief Skaggs and his team for their continued partnership. When thinking of the California Department of Education, it can often be associated with the word compliance. Yes, there is a compliance piece, of course, as we are the keeper of California Ed Code, but that is not the mission or focus of the work within our office. Our focus is on providing technical assistance, providing support to our school communities, providing leadership and guidance around initiatives, and advocating for the needs of our 6 million students in California. But we cannot do this work alone. And it is so important for us to build strong relationships within our counties and districts so we can hear and learn from each one of you the needs that are there for the communities that you serve. Remember, every child is one caring adult away from changing their narrative. We know one of the best ways to prevent death by suicide is by talking about it and mental health in general. One of our big lifts is rolling out and supporting the efforts of Senate Bill 224. Senate Bill 224 requires middle and high schools that offer health courses to expand mental health instruction. The great part is that there is very specific guidelines of topics that should be covered, including warning signs. As we know, it is often peers that notice signs or concerns before others. Explicitly teaching the students what to look for and what to do if there is a concern will make a difference in promoting a school climate and community of care. Creating an awareness and space to talk about mental health challenges that we have all experienced in our lives. And what can we do when we are in that space? What supports and resources are available will make a difference in the lives of our students. Although the language in the bill does not specify elementary age students, we know that it is best practice to provide mental health instruction to all of our students in the educational system. There are many resources available to support the work on Senate Bill 224, Wellness Education Lab, Sonoma County Office of Education's Foundations of Mental Health, and Erica's Lighthouse, to name a few. And by creating an action plan of how to roll out the initiatives to include having supports at the fingertips of our students, will change the fabric of our school communities. Remember, every student is one caring adult away from changing their narrative. Sorry, as a former high school principal, I'm aware of the challenges regarding students making choices that are less than ideal. I always say there is no such thing as a bad child, just bad choices. And as educators, we know that there's a reason behind the students making a poor choice. And until we know the reason why, it can be extremely challenging to address. With that said, our office is taking the lead on Senate Bill 153, which has 2 prongs. The first is to develop referral protocols for addressing pupil behavioral health concerns. What I really like about this portion of the bill is that we created the protocols in consult with very specific individuals, parents, educators, statewide content experts, student mental health policy work group members, and many more. Why is that so good? Well, we must have everyone at the table, and we need to hear their voice and build it together. It is truly the only way for us to work and create authentic protocols that can be implemented with fidelity. Remember, every student is one caring adult away from changing their narrative. So could you imagine what it would be like to have every person that interacts with our students receive mental health instruction to support our school communities? I could only imagine the benefits, but I see so much potential and hope. The second portion of Senate Bill 153 requires that 100% of certificated employees and 40% of classified employees receive youth behavioral training at least one time. And knowing this is a priority for our entire state, there was a fiscal apportionment to this bill that unfortunately has since been rescinded. But we do have options out there available to meet this new mandate and requirement. One is youth mental health first aid, and I will ask Sarah to drop that in the chat. And the other one we built in collaboration and concert with Chief Skaggs and his team that I'm super excited about rolling out, and more information will come on that. So thank you very much for the time today. And thank you, Chief Skaggs. It's an absolute pleasure to collaborate with your team to support our school communities. Thank you.
Thank you so much, Carrie and Ryan, for the overviews on the Office of School Health with CDPH, as well as the Office of School-Based Health Programs at CDE. And I now would like to introduce our next speaker, Justine Fisher with Cal Hope Schools. Justine will be highlighting the important work Cal Hope is doing to provide schools with support, resources, and strategies to help students, families, and educators navigate stress and adversity. Please welcome Justine Fisher.
Hi, thank you. Thank you, Sarah. And I want to thank CDPH and CDE for giving me this time. And as mentioned, I am with Cal Hope Schools, a part of Cal Hope, resources for schools to support youth and all of you in service to them. Can we have the next slide? And I would like to really request your indulgence today because what I really want to talk about today is my love for shoes. I love shoes. I have a lot of them. I've been married a long time to the same man, and he doesn't understand why I still have shoes from way back when we were first married 40 years ago. But I do have a lot of shoes. And one of the things that I can say about my shoes over the course of time is that my feet have changed, and one side doesn't fit all. Some of them are memory shoes, and some of them are shoes I wear every day, and some of them are shoes I can't wear anymore. But they mean something to me, and I'm glad to have them, and I'm glad to know that they're there, and I feel connected to them. And a lot of times I find shoes to be a metaphor for things like what we know at Cal Hope Schools, that, one set of shoes does not fit everybody and not right for everybody. Can we have the next slide, please? And so not every shoe fits every situation, not every resource fits everybody, but there are plenty of things and items, no matter what your size is. If you've got those cute little adorable children's feet, or you are working your feet hard on the trail or on a rock, or you're wearing shoes that maybe aren't so comfortable all the time, whatever it is that you have, there's some resource for you. Can we go to the next slide, please? And if you've ever been around a young person, or maybe even yourself, you know that one day everything is fine and those shoes are comfy and they fit perfectly. And then the next day your toes sticking out, or the sole of the shoe's been eaten away, or they just aren't working anymore. And so you need something else. Even though you might feel comfortable in that discomfort, you might be able to find something else that you need in a resource that can support you, or in a shoe that can support you. Can we have the next slide, please? And these are some of the resources that are available for youth. And we know that youth are different, like shoes. They have different things, different styles, different needs, high arches, low arches, big feet, small feet, lots of width needed, not so much width needed, thin double A heels, whatever it is. We know that there are people like shoes are so unique. And so we want to make sure that there's plenty of things. And this is a list of many of the resources, not all of them, but so many that are available. And it's not just youth that might need a new pair of shoes or support for some shoes, or support for their mental health. And if we go to the next slide, we have educator support, because educators are on that front line. And when I'm going to say, I'm using the term educator very loosely and saying those of us in service to students, whether we are in a health office situation, whether we are in a classroom situation, whether we are a nonprofit, whether we are after school, whatever we are doing, if we are in service to youth during the school day, then we sometimes need support too. Sometimes like we're just overwhelmed. I'm going to say today my shoes are soaking wet because it poured rain here and it flooded our backyard and I was moving things around. So I need resources. We all do. And so let's go to the next slide. Resources for caregivers. If you are like me, and I'm sure you are, we are the carers. There's some living thing in your life or many living things that need your attention every day, that rely on you for support and love and food and water and everything else. And sometimes that is overwhelming and it's hard to navigate, especially if it's your first time caring for someone. So we also have resources at CalHope for caregivers. And the next slide, please. So this is just a reminder. You may have heard a lot about these resources. You might have checked them out. You may have used them. You may have used them 3 years ago, but haven't seen them since. But what I just want to remind you is that whatever your situation is, whatever you need, however we can support you, your mental health, and the students you work with, the youth you work with, their mental health, the families, the communities, like a good pair of shoes, schools and CalHope resources are here to support you and your community. And if you can go to the last slide, please. And this is just how you can reach me if you want to talk about the resources or if you want to discuss your love for shoes, happy to do that too. The more that we talk and join and are together, the better off we are in creating those relationships that matter between us and the people we serve. So thank you so much for your time. I appreciate it.
Thank you so much, Justine. We will take a couple of minutes for questions. If you would like to look into the Q&A box for a couple of minutes, if anyone has any questions at this time for CalHope's schools and for Justine.
So I don't see any questions, but I do just want to share. Some of you may have previously viewed Angst through CalHope Schools, and I'm sad to say that it's no longer there. It's not, you're not able to watch that through CalHope Schools currently. So I know that has come up before in other webinars as to why Angst isn't there, but unfortunately it is no longer available. Great.
Thank you for letting us know. And at this time, we'll move to our next presenter. And if any Q&As come up for Justine and CalHope Schools, we will address those as they come in. So now I would like to introduce Diane Meza, who will be speaking about the California's Family and Community Engagement Initiatives. Diana will share how schools and communities can strengthen partnerships to ensure students and families have the supports they need to thrive. Please welcome Diana.
Hello, good afternoon, everyone, and thank you for the introduction. I am delighted to be here today. If we can go to the next slide, please. I want to start off by acknowledging the critical work in this room. Whether you're a school health professional, an administrator, a public health staff member, you share one vital vision, which is supporting the physical, emotional, and social well-being of every student. But what is most powerful is a mission you already have access to, right? And it's not a new program or a budget line item. It's effective family engagement and often the voice that gets forgotten, which leads me to the next slide. So family engagement it should be an integrated strategy, right? We define family engagement as a full, equal, and equitable partnership among families, educators, and community partners. Its sole purpose is to promote children's learning and development from birth through college and career. It's not a separate task. It's an integrated strategy for success. Next slide, please. So when we talk about family engagement and the why, is when we build relational trust with families, it acts as a foundation for profound improvements in student outcomes. We see direct benefits like improved attendance, higher graduation rates, better social and emotional development are some of the things that have come through years of research, whether it comes from the Department of Education or researchers that have been really invested in this work. Next slide, please. And to anchor the work in family engagement, I don't know, hopefully most of you have seen the dual capacity framework, which is what is used throughout the state of California and nationwide. There are different frameworks, but this is the one that I've seen consistently in the 2 years that I've been doing this work. And the question isn't if engagement works, but how to do it effectively. We rely on the dual capacity framework developed by Dr. Karen Mapp. It teaches us that effective engagement is systemic and relational. So it must be asset-based and culturally responsive, which is part of the process conditions, and then embraced by leadership and integrated into all strategies, right? It needs to be braided through all of our educational settings so that we make sure that it's a reoccurring action. It's not a goal, it's the integration, not isolation piece. And that's the message we've been carrying forward. A lot of the times, what we've seen is people think it's a department. And so they say, oh, that belongs to the family engagement department. But in reality, families should be a touch point everywhere. And so that is the key message. Family engagement is integration, not isolation. Next slide, please. So now let's connect engagement directly to your professional objectives because this strategy benefits every role. So if you're public health staff, this is key to strengthening cross-sector collaboration. Partnering with families gives us a direct line to understanding community level health needs. And this insight allows us to provide a more targeted and effective support and then build coordinated system of care that supports the whole child. Next slide, please. For school health staff, family engagement is your most effective tool for building trust and ensuring consistent student presence. A trusting relationship with family helps remove barriers to consistent care, ensure connection to necessary outside services, and address roadblocks like transportation or clinic access, just making sure that the child receives the support that they need and being able to have that connection and have that trust and conversations with families to get there. Next slide, please. Now we're going to look at the real stories. Let's put this work in action, right? Theory is great, but real life stories show us the power of relationships. So we have two quick examples that illustrate the challenge, engagement, and outcome arc. Story one, you have the staff member and the family, right? A health focus and the challenge. The student was frequently absent due to an untreated chronic health condition, and the student couldn't get a hold of the family, and the school couldn't get a hold of the family to resolve it. So the engagement piece comes in, and a dedicated staff member connected with the family, listening to their true concerns and barriers, which turned out to be a lack of reliable transportation to the clinic. The outcome? The staff member then took that information, collaborated with the family to secure transportation resources. And so the result from this, right, identifying that there was a need and taking action to engage the family, there's direct and lasting improvement in students' health attendance, overall physical and social emotional well-being. And it all started with one trusting conversation. We have another story where we had an administrator that recognized a significant need for more mental health resources, but wasn't sure how to reach the most disengaged families. And the engagement piece was thinking about connections and partnerships, right? So they recognize that a school flyer wasn't enough, right? It's not a one-stop shop. There has to be different communication channels. So in this case, they partnered with a trusted local faith-based organization that already had strong family ties in the community. And this partnership created a new trusted channel for communicating available mental health services. And so then this led to a significant increase in families accessing support, ensuring students receive the holistic mental health support they desperately needed. Because, trust is the currency of engagement. It feels like it's so easy, right? Building trust and establishing relationships, that is the core, but sometimes it's challenging, right? And I just always want to put that at the forefront, where building that trust, will go a long way. Next slide, please. So to summarize, family engagement is not an abstract concept. It's a powerful, tangible strategy that helps you achieve your goals and creates better outcomes for students and families across health, academics, and well-being. This is not just, educational. It really applies to anything that you're doing, right? Connecting with families and really building the trust. And I do want to point out that this November, we encourage to leverage Family Engagement Month as a dedicated opportunity to put these ideas into practice. I put the QR code to download the Communications Best Practices Guide for building family engagement awareness. And inside this guide, you'll find ideas for storytelling, communications templates, a calendar with sample content broken down by month, so that you can really think through the family engagement campaign and beyond. It doesn't have to be just family engagement. It could be different campaigns, but the core here that we really are promoting and getting and preparing for is Family Engagement Month next month. And we're really excited for that. So I hope you download, you scan the QR code, and you will get a copy of the presentation. So all of that information's on there as well. Next slide, please. All right. So instead of overwhelming you with a long list, I want to leave you with one single tangible action for the week. So identify one key partner in your community today, like schedule a brief 15-minute meeting with them and commit to simply listening. Ask them, what are your biggest barriers families are facing, and how can we support you? And see what type of response you get. A lot of that's how we learn, right? When we start communicating, connecting, building trust, and really shaping how we do things, right? So others, when you figure out the needs, then that really informs what your goals and your next step will be. So, in addition, I do want to remind you that your work is powerful. Don't forget to actively plan for Family Engagement Month in November and share your stories. You can send them to my email address that's listed there, and use the hashtags so that you can share your amazing work that's happening across the state of California. Next slide, please. And with this, I leave you with the family engagement resources and frameworks that are used throughout the state. Thank you for your leadership. And if you are interested in scheduling a one-on-one for thought partnership, please contact me at diana@cdefoundation.org. And let's go build trust and drive impact. Thank you.
I couldn't have said it better myself, Diana. Thank you so much. We will take a few minutes to look at the Q&A feature and see if there are any questions for Diana at this time.
So there aren't any questions. However, I would like to ask Diana if there is a success story that you would like to share.
Sure. We have the newsroom where we're promoting success stories everywhere, but an example of family engagement, we have Kings County has a home that they're leasing specifically for homeless youth, and it is centered in a location where they provide transportation. They have washer and dryer, snacks, a pantry, you name it. And so there was a need in that county, and the administrators and leaders recognized that, and so they invested right in their students and their families that are struggling. And so now there's a home. Just learned about that like 2 weeks ago. That's my favorite part of my job is I'm looking for stories everywhere. That's just really something that they're working on, that they're prioritizing, and other districts are modeling. So that's one that really stands out. And then we have at CNUSD there's a the Dream Lab, the Dream STEM Lab, and so Home Gardens Academy, they have a Dream STEM Lab where it's not only for students, but they open it up for families. So they have a calendar and they have STEM activities, but also different types of workshops, financial literacy, college information, you name it. And it's just really great that they're able to have a place where parents already know it's routine. They're often a voice that is a part of, right? And so what we always say is make sure that you're always asking the question, is family a voice on, in the table, right? When we're planning, do we have the family and the student voice to make sure? Because we often forget, I know LCAP and MTSS, those are kind of anchored, right? Family engagement are domains, but in order to integrate it needs to be really just looked at and prioritize. So that's what we're hoping to accomplish in November and through our work. That it's important, and there's simple ways that you can start, right? Talking about it simply, even too, if you look at a website, a lot of the school sites are already doing work, or organizations are already doing family engagement work, but they're just not telling the story. So even creating a web page with how you can volunteer, different spotlights about families and students and educators, just to capture the essence and capture that, there is that synergy and there is that collaboration, and really, again, working on establishing and building trust within your families. I think it's probably the most important piece. And Dr. Karen Mapp, I saw her 2 weeks ago, the creator of the framework, and she said, I know you go back to basics, but really number one before you do anything is establishing trust. Talk to your families, connect with your families.
Thanks, Dana. We
And
have, oh, go ahead.
no, I have a lot more stories. And so much so that I would have to look at the newsroom. I could be here forever. But in our contact, you'll be able to see our newsroom. And on there, you will see all of the different stories that are happening around family and community engagement in California.
Awesome. We do have a hand raised. Stephanie Garcia, if you would like to come off mute and ask a question. Maybe not. Hand back down. We have a question in the Q&A though from Vanessa. Says, what is the best way to engage families in school activities? Sadly, we don't have the funding to provide food, daycare, or transportation, but what are other ways to engage more families in school meetings, etc.?
So this question comes up often, and that's a great question. Thank you. And I think that a lot of the times when you're planning to invite families, it's an afterthought. And it's really what I recommend in my years of being communications director at a K-12 is intentionally planning, right? So it's not just one flyer that goes out. It is phone calls. It is the messaging shared with your students, right? So that they can also relate to their families. Uh, it is your printed flyer give to your parent every Wednesday, right? At least with me, children in public school, every Wednesday I get my folder and I go through and I sign and look at what I need to look through as well as Dojo. But really using all of your communication networks and and plan in advance to be able to get the events on the radar. I mean, I do advocate for for some snacks. Really, have, even if you have maybe community supporters that you can ask for donations for food or snacks. I think it's really important to set up a welcoming environment for your families so that you don't so that you can break down those barriers, right? It'll be easier for them to feel comfortable and come in once you're taking their needs into consideration. You're giving them the time, and if you can get creative, right, and really let them know the importance of them coming to these events, and and really plan them strategically, because I have seen schools that have different types of events, and it while it's good, you have to always kind of go right back to the mission and be strategic about what we're asking families to do, because they have to, maybe not cook dinner, and some of them might have transportation issues. So allowing them that time to be able to plan ahead and having those conversations, even by phone. Hey, I haven't heard from you, but we would love to have you here. Will you be attending? That's when we've been the most successful, versus a one stop, like a one flyer type of thing. Send it out 3 times, and then whoever shows up shows up. That doesn't have the biggest success. So that's what what I can speak to based on experience, and what I've seen and heard from colleagues.
Thank you, Dana. We have another question that says, who are leading researchers in this field in California that we should follow and engage with as we continue to find best practices and lessons learned?
So we had the framework for Dr. Karen Mapp, and Dr. Joyce, and the information is on the last slides, which we will be sharing. And so it's linked there, but those are the two most common. But I would say Dr. Karen Mapp probably is a little more universal, which is a dual capacity framework, and she's out of Harvard University. And has done a whole lot of research and is super familiar with the state of California. She lives in Boston, but in the state of California, a lot of good works happened here. So that's really good. We also have up and coming. We have a California Family Engagement Network, they're focusing on educator capacity, teacher preparation. And also the California State Family Engagement Center, who's kind of they're also coming up as leaders for the family engagement work. They are federally funded, so unfortunately there's some funding changes, but there'll be more information. They're still committed to the work, but they are still there, overseeing the state of California's family and community engagement center.
Thank you. And Carrie, I see your hand up.
Yeah, that was great presentation. I'm gonna, in practicality, I dropped some ideas as well as a high school principal. I was the principal at Woodland High School. We had a very small budget, and some of the things you can do, which I found to be very rewarding, is being present. What does that look like? As a high school principal, what the entire staff and office would go out with our coffee cup, being present when they were doing drop-offs, kids on campus, and just constantly being that force. Another great resource is to pull your school community. Ask them what they want. What do they need? And based off of that, create your workshops or your events based off the needs of the community. Because although we can look at the best researchers, and there are tons of them, I love the ideas, it's always going to be independent of where you serve and the community that you serve. I also think that hosting a coffee is great. And the biggest thing for the buck that I did is, you know how at a high school they charge kids to go into games? That is absolutely ridiculous. Yes, we had to pay for the refs. Yes, there is a fee you have to pay for the lights. I understand that. But allowing kids to come in, there's no ed code that says you cannot host a kid at a school-wide event. In fact, I could argue that I don't know how we are charging for a school-wide event. But that's another big thing. We did that as well for proms. As well, I would go to ASB. I'm like, all right, I need 12 tickets. And I would go in there and I'd ask for it. There are things you can do you don't even realize that would actually increase your school positivity, climate culture. Sporting events are huge. I can't even tell you how many times I'd see kids just standing outside the gate at Woodland High School because they didn't have the funds to come in to watch the game. So that, and then they go home and they tell their parents, and then their parents maybe will come and say, hey, Miss, I went by Carrie. Hey, Carrie, Miss Carrie, can we go to the game? I'm like, absolutely. Absolutely. But those are just some of my ideas. Great job, Diana. Sorry to add.
Not at all. This is good. This is real stuff, right? And my communications experience, that's been my bread and butter for the last 20 years, is I won't do anything without a communications plan. And it's making sure that you know your demographics and what can you tie to that, right? Do you have the budget? What's the research piece, the planning, the tactics, the goals, all of that, right? Because it really allows you to think up front about what you want out of this event or initiative or campaign, and knowing your demographics, tying it to your goals, going right back to that to make sure that you have, the most successful campaign or event. And within the guide, you will see that that's kind of that's the mentality where we were trying to get at when developing the communications guide, is really in a school setting, how you can start having those conversations. It's not going to happen overnight, but planting the seed is already a good move. And then just, watering, and hopefully it sprouts and turns into something bigger. But what we're doing is just, hey, don't forget about family voice, about family engagement, because it is important. And and it's often the voice that's missed. And we are our parents' first teachers, so just co-creating and really being able to do some good stuff, I think, goes a long way. And I have, even just me personally, stories with my teachers, and how that connection with the school home partnership has really benefited my kids, my own kids, right? And really staying in tune with what's happening, and how I can support them at home and at school.
Thank you, Diana. And thank you for this question and answer session. This was super informative, and some wonderful resources that came out of this. So we are transitioning to a moment of mindfulness. So I would really like to introduce Vanessa Fuentes from the California Department of Public Health, Office of School Health. Vanessa will lead us through a moment of mindfulness and co-facilitate the remainder of today's webinar. Please welcome Vanessa.
Thank you, Sarah, and thank you to all of our speakers. Hopefully you feel inspired and empowered. So we're going to take a quick moment. This is your rest stop for the webinar. So I'm going to start off with a scenario, and you can use the bunny as your guide. So imagine yourself walking through a quiet forest trail. The leaves crunch gently beneath your feet. Golden and amber all around, a soft breeze carries the scent of earth and wood smoke. You pause, breathe deeply, and let the calm of autumn settle in. And we're going to go through 5 different grounding exercises with our taste. So one thing I want to ask you is, notice one thing you can taste. Maybe you have a cup in your hand. Maybe a sip of warm apple cider, or a hint of roasted pumpkin. And I just happen to have a pumpkin here. And I also have some cinnamon apple spice for you. So now moving on to smell, take a slow, deep breath. Can you smell crisp leaves, bonfire smoke, or the earthy scent of a rain-soaked ground? Now moving on to hearing. Listen closely. Do you hear leaves crunching? Wind rustling through trees, or geese flying overhead? 4. Feel. Bring your attention to 4 things you can feel. the cozy texture of your sweater, a cool breeze on your skin, the warmth of a mug in your hands, the ground beneath your feet. And what do you see? Maybe an orange or red leaves, pumpkins on porches, long shadows from the autumn sun, people bundled in scarves, a squirrel gathering acorns. Thank you very much for being with me through this exercise. I'm going to now move forward to introduce you to Dana Barrios and Janine Gaines. Dana and Janine, would you like to join me?
Yes, thank you so much, Vanessa, for having us. Thank you, everyone, for being a part of this important call. We are super grateful and honored to be in this space with you all. My name is Janine Gaines. I'm the Director of Partnerships at the Social Changery, and we are one of the partners of the Children Youth Behavioral Health Initiative.
Oh, hello, everybody. My name's Dana Barrios. I'm the Senior Collective Impact Manager here with the Social Changery. Super excited to be here today and talk a little bit about community engagement, and I'll kick it back to Janine.
Awesome, thank you. So we're here today to talk to you about the Children, Youth, and Family Network within CYBHI, just to share how it came about, what the work that we're doing, and then some lessons learned along the way. So the CYF network actually started out of the Youth at the Center report. So the Youth at the Center report was commissioned by CYBHI. And I guess I should just explain what that is in case I know we have a wide group here, but the CYBHI, the Children Youth Behavioral Health Initiative, is California's work to reimagine the mental health system for youth and their families, a 5-year multi-billion-dollar investment to do that. So at the start of the initiative, we were contracted to work with CYBHI to create the Youth at the Center report to really talk to youth and families about what was needed. If the system was going to change, what does that look like for them? What do they want to see at the end of the 5 years? So we worked with 29 organizations, convening nearly 50 meetings in 2022, and talked to more than 600 young people, families, and community members to really hear their stories and see what this should look like. So out of the report, there were 3 areas of work to be done. And 12 calls to action. And those areas of work were to shift thinking, reimagine services, and transform systems. And Dana has dropped the report into the chat if you have not had a chance to read it. But after all of this conversation, it was everyone quickly realized, like, how do we keep this momentum going? It's not enough to talk to people at the beginning, and then 5 years later, hope things worked out. How do we continue to engage youth and families and make sure that they are at the center of the work? So after the report was written, there were KIIs that happened to talk to organizations and say, hey, if you were going to be a part of this, if we're going to keep children, youth, and families at the center of this work, what does that look like? And through these key informant interviews, it was determined that we needed to have a formalized network to continuously be able to talk to youth and families to be able to inform the work. And I do want to say within CYBHI, there has been a ton of youth and family engagement outside of the network. The different work streams, some of them have their own youth groups they work with. Some have their different advisory councils and networks, but it was determined we should have one that is able to be tapped across work streams, really doing this work. And so as we were looking at what we wanted to do, obviously having trusted messengers is the most important. And we also realized when we're building this network that really working with community-based organizations was going to be the best way to do this. Sometimes when we have youth groups or family groups and there's 20 spaces, that's a lot of pressure for one young person to represent all Native youth or all Black youth within California, because there's only one spot for them if we want this to represent the diversity within California. So we said, hey, instead of having one young person or one parent hold that spot, why don't we work with organizations that reach those groups? That way, when the time comes, it's not just this one person, but we tap that trusted messenger within the community, that trusted organization, and then they can reach 20, 40, 50 young people or families to be able to advise on the network. So we created an asset map of California. We looked at how can we within 20, 25 organizations really represent California? So ensuring that we had all of our CRDP groups covered, recognizing we needed to make sure, do we have rural groups? Where in California are these organizations located? Can we really try and touch every community within California through this network? I will also say, because this has come up before, I mentioned why we didn't work with individuals, but the other reason that we did not work with youth directly within the network is through the work of CYBHI, we're talking about really serious topics. We're talking about mental health, we're talking about ACEs, we're talking about suicide prevention. And Dana and I really believe that when you're doing this work, if you're going to open someone up and have them talk about these things, you have to be able to appropriately close them as well. And that is not something that we are able to do. When you're working with youth, if you say that you're going to be there for a young person, you have to be there for that young person. And that's also not something we were able to do. But we recognize that these organizations who already have relationships with these young people, they will be able to close them up appropriately to make sure they have the resources and to be there for them. And so that was why it was really important for us to have the organizations as trusted messengers. And for us, the reason that Dana and I were tapped to do this work is we come from a nonprofit background. So we're actually trusted messengers to the organizations because we know what it's like to work in a nonprofit. We know what it's like to, be pulled in a couple different directions and seeing where you fit. And so really having trusted messengers reach out to other trusted messengers was really important for the creation of the network.
All right, so kind of going over, thank you, Janine, for that. Kind of going over a little bit of what the Children, Youth, and Family Network looks like. So the Children, Youth, and Family Network, as Janine stated, is basically a statewide network of youth and family serving organizations. And they really are consultants to CYBHI and really to ensure meaningful, authentic engagement with community. The network is convened by the Social Change Team, Janine and myself, and we're also able to provide technical assistance upon request, such as how to engage with youth and families and communities, some of the best practices that are out there, stigma reduction strategies, and outreach opportunities, and more. So one of the really great things about leading the network, as Janine said, is there's such a wide variety of experiences as well. So sometimes maybe we're not doing the technical assistance, but one of our partners is as well. So it's really this collaborative effort and collaborative environment that we've really created with the Children, Youth, and Family Network. So what does the network actually do? So they do a wide variety of things. So access to communities, family, and youth for consultation and feedback. This is honestly probably one of the biggest pieces, because if you're going to ask something of community partners, right, to disseminate information, let's say Take Space to Pause or the Live Beyond campaigns for CYBHI, community really has to buy into those resources. They have to really be like, yeah, these resources would be a great fit for our communities. And so we would have representatives from those various campaigns come to our meetings and allow people, the community partners, to provide feedback saying, this would really work in my community, or you know what, this isn't really something that would fit in my community. Or we have a lot of requests for things in Spanish, making sure that we, then relay all that information back to CYBHI leadership and work streams to really ensure that dialogue between community and the state partners. This also included rapid response requests. If you work in nonprofits, sometimes you get those last minute asks where you're like, hey, can you get this in 2 days? And you're like, oh, I don't really want to ask community partners to like drop everything and have this in 2 days. So we actually wrote this into some of our you'll see we have various engagement levels into one of our engagement levels. So organizations are actually okay with having us reach out last minute and saying, hey, can you get like 10 youth to review something within the next couple days? And so that was something that was really, really helpful. My favorite part is the ongoing learning and support that actually happens within the CYF network. Janine and I are very community-oriented people. And through COVID, when all COVID happened, I know a lot of times we couldn't actually have those face-to-face conversations. And we actually had kind of virtual communities. And so that kind of carried over. And we really have these virtual communities of practice. And I always say that we really are building community here. We have quarterly learning webinars where we have our community-based organizations along with the CYBHI work streams come together and really have that dialogue and do some education in a very equitable way for each other. Again, we do individual technical assistance, and we also did regional meetings last year. So we would go to the various locations throughout the state, so like Southern, Central, and Northern California, and get together in person. So we also really had that in-person connection as well. And then in January, we're actually going to have our big statewide event where we're going to have partners come from all over California and kind of gather together and really talk about the sustainability of CYBHI and what that looks like. And so at the end of the day, it was really building community, because all the network partners come from different backgrounds. We have really small organizations, really big organizations like ACLU. And so they all have different strategies when working with community. And we really took that opportunity to learn from them and allow a space where they can learn from each other as well. And lastly, disseminating information to communities. This is probably the biggest success of the CYF network. Janine will talk a little bit about numbers coming up, but we were really able to ask our network partners to really get out into community and disseminate some of the CYBHI materials and information that is out there. Because sometimes, we sit at our desks and we think, oh, this is a great idea. This is going to reach all kinds of people. And then you go to community and they're like, wait, what was that? What resource? And in this way, everybody's really hip to like what's going on with CYBHI and all the things and all the great tools that are coming out of the initiative. So then they're able to go out in the community when they're tabling events or have it in their waiting room. So you'll have take space to pause information, you'll have other mental wellness information. And so it was really, really awesome. And lastly on this, we also have the newsletter. So we do a newsletter every month where community organizations can share all the cool events that are coming up in their area, any other engagement opportunities, cool conferences. So it was a really great way to really create some community efforts and to really kind of come together for that. And contracting and engagement levels, this was a really big deal, I think, for us. And there's also a lot of learning opportunities as well. So part of the CYF network's role, or part of our role at the Social Changery, is to kind of be that intermediary between the state and the community. So we do all the in-house contracting because oftentimes you have really small organizations that may not have all these insurances, may not know how to do all these contracts, but their voices are just as important as these really large organizations. And so we actually do all the contracting in-house, which reduces a ton of barriers for people to be able to participate. And also it provides an opportunity for us to do some education, and so they can build capacity as well. So we'll actually provide technical assistance, like, you don't know what W-9 is, let us help you out. Workers' compensation, let us help you out on what that looks like and making sure that you have all your ducks in a row. And so that's been really cool and really able to help community organizations build that capacity. Next is also different engagement levels. So one of the things is some organizations might not have very much capacity. Some of the smaller orgs may have 1 or 2 people that are actually in office. And so we really created different engagement levels when contracting with people. So some people would just come to meetings, provide feedback, pass out materials at events, and other people would be more those rapid response requests, that technical assistance piece. And so we really wanted to create multiple engagement levels to allow that flexibility for community. And most importantly, participation was compensated. As Janine said, we come from hearty nonprofit backgrounds where people ask us to do things all the time. We're like, God, we don't really have the budget for that, or we don't have space for that. And so being able to compensate people from their time was a real blessing for us and is something that is extremely important when working with community. And then there was also additional opportunities for compensation and sponsorships through the various campaigns through CYBHI as well. And most importantly, it's creating trust and building relationships with community. That is something Janine and I both take very seriously as community people. Is the only way we're able to do our jobs is if community trusts us and we have relationships with community. And so that's exactly what we do our best to do. And so here are all of our 2025 network participants. So as you can see, there's people from all over the state, all the CRDP populations, special populations as well, rural, urban, I'm a Southern California girl, so I'm like, yeah, let's go SoCal. Janine's up in Northern California, Sacramento. And so we just really try really hard to have organizations that we feel really represent voice. And we also sit and take a second and it's like, who else should be at the table here? And really kind of have that ongoing, ever-changing family network of partners so we can ensure that we do our best to have as many voices at the table as possible.
All right, so now we're going to talk about just some of the best practices and lessons learned. We're now in our third iteration of the network. Every year it's a little different because we learn new things. Dana and I kind of brainstorm this, so we'll be maybe hopping back and forth on hitting some of these topics. But number one, it was really important for the participants to be paid. I always say if I'm getting paid to do this work, all the people I'm tapping should also be paid. And so we are able to stipend the organizations that are participating. And then that way they're also able to stipend the individuals who they're asking to participate. Our genuine relationships are very important to us. People are savvy. They know when you're checking a box. They know when you called them last minute, just because you have to say that you talked to them. And so it was really important that Dana and I are constantly in community, that we are giving and pouring into the community, and not just extracting. That's really important, that the people that we work with know that we have their back, that we're advocating for them, and that they feel like they're getting something out of this as well.
And they can see
Dana,
the changes too. I think that's important as well. Like sometimes you'll ask people for their feedback and then it just gets lost somewhere and they don't really actually see it in real time. So being able to ask for feedback and then actually show like, hey, this is what we did with their feedback. And we would even connect partners with Dr. Sood, and being able to have that direct line and that direct communication and advocacy was really important to building trust and building relationships.
Yeah, and not just within CYBHI, but also within the network. At the end of the year, when they're giving us feedback about what they would like to see, we made sure that we had that continuous feedback loop, and the structure changed each year based on what our partners were telling us. We really focused on like these community meetings and sponsorships and events, that it wasn't just you need to participate in what we are doing, but ensuring that we had sponsorship dollars and support for the events that our partners were having. There is no need, if a community already has an event that they believe in, I don't need to start a new event to talk about CYBHI.
Totally.
I should invest in what the community has already said works for them, what they love, what they enjoy. We need to invest in that and not try and recreate the wheel and do new things when the community has already embraced something else.
Yeah.
And on the right-hand side, a couple of the things that we really, for the structure of the network, one, having orientation meetings to get everyone on the same page. That was really important. We didn't want to just send an email out asking to participate, but having meetings to do that. Ensuring that there's equity in the quarterly meetings, having our partners present as well. It wasn't just hearing from the state, but hearing from them, and also clarity of roles, making sure that everyone knew their areas of influence. We didn't want to tell people just, hey, you can weigh in on everything if they actually can't. So where are the areas of influence? What does this look like? And making sure that everyone understands their role.
All right, so we got to wrap it up in a minute. So you want to go over this real quick, Janine?
Yes, so we are running out of time, but this is just some pictures of CYF Network out in the wild and a couple of numbers. So we've partnered with over 30 organizations since January 2024 till now. We've invested almost $250,000 back into the community. That's dollars that went directly to the organizations, either for the time that they had spent or for sponsorships that they had. And our partners have directly touching 49,070 community members since we have started the network.
Oh, I love hearing that. That's awesome.
Yes. So I don't think we have time for questions because we went a little over, but we will be here and can answer in the chat.
Thank you, Dana and Janine. It's always a pleasure to have you. So without further ado, we have Sergio Morales from the California School-Based Health Alliance. Sergio, are you with me?
Here I am.
Perfect. Let me know if you need me to share screen, okay?
Okay, I'm gonna go ahead and share.
Perfect.
Let's see, we good?
Excellent.
Excellent. So, buenas tardes, folks from across California who are here participating in this conversation. I want to thank both the Office of School-Based Health Programs and the Office of School Health from CDE and CDPH respectively, just for inviting CSHA to kind of share a little bit about our work and how we have some tools that could help you all think about family and community engagement. CSHA has been lucky to work with both of these respective departments who are calling us in together today to share some resources. And we participated in webinars in the past. So I'm hoping today I can give some highlights of what we believe are kind of our accessible integrated care of a school-based health and wellness centers and think about or lift up some tools that I think could be helpful as we engage family and communities. And with that, for those of you who may not be aware of CSHA and our work, is we are a statewide nonprofit organization. We've existed for a little over 30 years now, and our goal and effort is to really help improve academic and health outcomes for California's K through 12 student population in public schools. Quite simply put, we like to say that we help put healthcare where kids are, right, in schools. And I think many of you all could see the value of that and know what that looks like. CSHA also invites folks to participate as a member of the organization. All our services and resources are free on our really cool looking website. So I encourage you to check that out. But we also, ask folks to participate in, having an organizational commitment in supporting the school-based health movement in California by joining as a CSHA member, which we also comes with benefits, including some TA hours and also a pretty reduced registration rate for our conference that we host every year in April, which I'll talk about in a second. I want to give a brief 101 update, right, of what this looks like in California for school-based health and wellness centers. We have a definition of school-based health centers that's been in both federal and state statute for a number of years. We know that over the past few years, and I think COVID being a real indicator for us, is that there's been this real emergence of focused on wellness centers, on behavioral health services in California schools, much to the thanks of our LEA partners across the state who've really been saying, COVID did a serious number on us, and we really recognize that young people need a lot of behavioral health support, right? So that coupled with this investment of the California or the Children's Youth and Behavioral Health Initiative has really done a lot of support for students and their families in California. So this is a slide that I have just to kind of say the name game, because throughout California, we've seen many different names for describing your work. And, again, there is a definition of a school-based health center and school link center in both federal and state uh, codes. However, wellness centers isn't entirely defined. And so CSHA, as the leading kind of organization that's really a nonprofit organization in the state that is helping to convene and connect and share best practices and resource tools to the field, we have just recognized and believe in sovereignty and people naming and choosing an identity that fits best for them in their model. But in terms of helping to gather folks and create some guidelines around what that looks like, we've created some definitions to help kind of gather and connect and convene the field across California. So for today's conversation, I just want to be able to name the two definitions that we've come up with to help define some identities and help folks, be in spaces that we could name and say how we can support you, right? So ultimately, a school-based health center is a student-focused health center located on or near a campus that provides age-appropriate medical services by clinicians, right? And so just recognizing that services are ideally provided in person, or telehealth is an option, and clinicians really using both terms that are identified by HRSA, right? The Health Resources Services Administration, that is the federal entity that helped kind of define school-based health centers. Um, they may also, school-based health centers may also provide behavioral health, dental, optometry, or ancillary services like health education and youth engagement and case management. So just to kind of name that definition. And then a wellness center is, what we've gathered based on the name game, that I shared earlier, is just being able to help provide a guideline, right, of what this looks like and what we're seeing in the field in California. So again, you'll see some similarity in language. Again, student focused, center located at or near a school campus, providing age appropriate clinical behavioral health services by providers, right? And we're defining providers at this point, what the California BBS uses. And then we know that, with CYBHI provides, the fee schedule provides a number of services, right, that are able to be offered and have a fee schedule to gain some reimbursement from both our commercial and managed care plans. So our kind of, the way we frame it is if you have a clinician on campus offering clinical services, then CSHA is willing and ready to walk with you on the journey and to provide you the tools and best practice information to strengthen your service delivery system for your students and community in your neighborhood. So with that, kind of talking a little bit about what that looks like, we came up with this continuum of services that really looks at what is offered, right? For those schools who offer calming rooms, which is a drop-in space, and may have a really cool, decoration in the room and some toys or fidget toys or some space to help deregulate for a young person. Really important for students to have a space like that on their school campus with a caring adult. But again, for CSHA purposes, how we can best help those folks is connecting them to resources. But really, we have a lot more resources and best practices over the past 30 years for those schools and spaces in schools that have clinicians on campus and have clinical care to offer to students and families. So just wanted to share that continuum so you all could see what that looks like, just because in terms of practicality, that might make a little bit more sense. So just curious, for those of us who are able to do a chat, I think that our chat is now open. Just curious how many folks or how many school-based health and wellness centers are operating in California? What's folks' estimate? See if there's any responses here. 37. Cool, seeing some numbers here. Yeah, we have 6 million students I heard Dr. Sakara mentioned earlier. And we have, at this point, thanks for folks who are responding, appreciate that. To CSHA's knowledge, at this point, there's about a little over 400, right? And that number is growing. Thanks for those of you who chapped in here, or chimed in here, excuse me, in the chat. Chapped in is my new term. For those of you who chimed in, right? We have about 400 that we've been able to collect information through our wonderful snowball technique, to be able to say there's a clinician on campus, we have an address, services they offer, and who the sponsoring agency is. So in looking at that from our information and what we've gathered, we know that the vast majority of services that are being offered are mental health services due to the growth in wellness centers over the past 5 years. Looking at this, services provided 10 years ago looked very different, with medical and youth engagement being a higher number. Now, thankfully, we're able to see a kind of flip on that and really see a lot of behavioral health or mental health services being offered in school-based health and wellness centers in California. We're also able to see that 67% are medical, youth engagement after school programs, youth leadership development programs are critical and key. So see a solid number of that as well as our dental screenings, and fluoride varnish at about half of them. And then reproductive health, we tend to see a lot more in high school settings or school link settings. And then comprehensive dental care, we see that as a growing number, which is excellent in terms of increasing comprehensive health access points in California schools. About 50% of the comprehensive school-based health centers are run by federally qualified health centers. We're talking earlier about partnerships and engaging, community and young people. For those of you who are in schools, if you haven't partnered with a federally qualified health center in your community, strongly would recommend you all looking at who that is and try to partner with them if that isn't established already, because FQHCs can bring a variety of different services through this partnership. We have hospital systems as well. There's a few models in California of hospital systems operating school-based health centers. Another excellent model as well. And then school districts. We're seeing more and more school districts, definitely with wellness centers and behavioral health care, but we also know school districts that operate medical services as well and are the primary medical provider in coordinating comprehensive medical care to students through school-based health centers or schooling centers. So just want to lift up the different modalities that we see here. And with that, again, 45% of folks who are served through school-based health and wellness centers are in high school, with middle school at 14%, elementary at almost 20, and just recognizing again the importance of our mobile units and our school link that may be across the street, or in an area where students and families could get to. So just recognizing that it looks very different. I also just want to name, in terms of partnerships and family and community engagement and engagement of young people, right, that 53% of our school-based health centers now serve the broader community. So again, an excellent way to think about engaging community members, right? That many school-based health centers now have an entrance for students facing the campus side, and then a community entrance for community members to come and access services at the center. And we are seeing and know that dental services are really critical and key to help bring in a lot of community members in. So just want to lift up some promising practices that we've seen and how this really benefits our communities as our schools as sites of communities for healthcare and practice. Looking at the impact, just to highlight some key outcomes that we've seen about the impact of school-based health centers. We know that when young people have access to a medical, dental, behavioral health, vision appointment on a school campus, they can walk to that appointment and then walk back to their classroom. They may have missed a few minutes of one class or a period, but really increased seat time, increased educational outcomes, access to school, to healthcare, is increased by being on a campus. Um, we've definitely seen some school connectedness as well. Our partners over at the LA Trust for Children's Health did an excellent study that was published in the Journal of Adolescent Health, where they looked at the correlation between ADA rates with one visit going up about 5 days, and then with an actual medical or behavioral health visit going up about 7 days. So there is some real opportunities to think about how both we are able to achieve both health and education outcomes through establishing school-based health and wellness centers on campuses. So just wanted to lift up some of the key impact areas. Again, I would be remiss for our many of our young people with asthma and chronic diseases, right? I think many of our schools who don't have school health centers, our school nurses hold it down for us, right? And helping to support our young people with their albuterol, with managing their asthma, but knowing that when you have a medical provider on campus, rates to emergency departments go down, right? And that is an important dynamic to factor into how school-based health centers are part of a primary care model to really support young people in connecting them to their healthcare needs. Uh, with that, another key tool that I want to lift up for you all, Marcel in the chat shared our Vision to Reality Toolkit, which is our signature tool that really helps folks, and like we don't know where to get started, right? I strongly encourage you to download that tool. Another key tool that is on our website is our Student Health Index, which is California's, what we believe is our first kind of comprehensive analysis to identify counties, districts, and schools where new school-based health centers will have the greatest return on investment for improving student health and education equity. You literally can go to our website and look at our student health index, type in your address or an address in your community, and it'll list the schools that are in the area, if they have a school-based health center, and some additional data sets that can help you understand the need for a school-based health center. We know from our data that there's a real opportunity to expand access to care. We know that there's about 10,000 plus schools, and I heard earlier about 6 million students, right? So with 400 that we know school-based health and wellness centers and 10,000 schools, there's a whole lot more students, tier 1 schools and not, that need a lot of support. So if our tool on our website could help you in framing partnerships, strengthening grants, applications, or as a community planning process, we welcome you to use the tool. And hopefully that can help you out with that work. And you want to build a school-based health center, even better, right? Again, this is how CSHA works to advocate for school-based health centers, looking at the qualitative evidence of need, the quantitative evidence of need, and then trying to figure out some feasibility there. How do we support folks thinking through that work? So with that, just want to give some quick highlights of the data of what we use, what indicators we use, and the sources and the years of which they were cited that make up the Student Health Index. So, we have some health and healthcare data sets that are pulled from the census tract, some socioeconomic data pulled from the census tract, looking at poverty amongst 18-year-olds and under, the uninsured, and looking at the California Healthy Places Index. We also leverage some school level data from indicators there, and some other county level data that we're able to get around mental health hospitalization rates and foster care, students in foster care from CDE enrollment data. That's a little dated, but just sharing a little bit about how what our index looks like. We added in 23, in June 23, new metrics that we felt will help also tell this story of a snapshot of our student population, looking at percentage of households with no vehicle, and then COVID vaccination rates by zip code. So that is in our data, in our data set. We have some signature tools, again, that I want to lift up. Vision to Reality, which is the direct link to the website is there, and Key Steps to Planning. So with that, I also want to lift up some upcoming webinars we have in the next couple weeks. This is very helpful, I would say, I would imagine, to our LEA partners. We are doing a webinar to support our LEA partners and school-based health center leads around supporting immigrant and LGBTQ youth during challenging times, as well as lifting up the model of wellness coaches and figuring out how that could be a critical strategy to supporting school-based health center operations and wellness center operations. So with that, I want to say thank you. There's my email and our socials there. There are a few resources in the chat that I believe should be helpful to you that CSHA has on our website and then our website as well. So with that, I'm going to pause. I know we are nearing a time, so I don't know, Vanessa, how should we best use this remaining minutes that we have?
So Marcel already answered the majority of questions. I would
As he
like to,
usually does.
he's amazing, right? So I would like to ask you a question. The
Sure.
question is, what is your favorite success story?
My favorite success stories, I just shared this, and I share this, I lift up this story a lot because it says and it speaks to the beauty of what school-based health centers are able to have an impact on young people. I started my career in school-based health centers with Tiburcio Vasquez Health Center, working in Hayward Unified 20 years ago. And what young people were saying 20 years ago, I worked at Tiburcio for about 9 or 10 years. And what students were saying from 2004 to 2012, 13, when I was working there, and when I have the opportunity to go to school-based health centers and tour today, young people still say this place is my sanctuary, right? So the fact that, young people in schools and educators doing an amazing job and have a full plate of responsibilities to get done, right? And in partnership and recognizing the power of partnerships with your school-based health provider, the fact that young people have somewhere on their campus where they could go and speak to a caring and trusted adult to provide them tools, resources, and information to help them make healthier decisions and or connect to care is my success story, right? And the fact that young people are still able to say that's beautiful. Because we all know being young could be a challenging time. So when they have adults to connect with and medically accurate and information and resources and tools to support them with their decision making, even more so.
As always, Sergio, Marcel, everyone at CSHA, and all of our speakers, we are so grateful to have had you. I'm going to be sharing my screen with the emails, just so you know we are here, just as Sergio just mentioned, to support you. So with that, have a great, wonderful day. We provide technical assistance to school administrators, educators, school health staff, you name it. So even though we might not be the subject matter experts, we will connect you to the right people. Hopefully you are empowered and motivated to go forth into your day. Have a wonderful rest of your day. Thank you.